You're probably asking yourself, why is there a specific module only about pushing? Well, here's the thing. Over the years working with clients and teaching students, one of the number one things I would hear about labor that was challenging was knowing how to push, which actually makes total sense because no one teaches you how to do that. And most women in labor learn how to push in labor. But here's my theory. Pushing requires you to use muscles in your body. Muscles can hold memory and muscles can be conditioned. So there's value learning now, before you go into labor, how to optimize your muscles to make pushing effective and more comfortable, especially if this is your first pregnancy. To kick things off, let's have an anatomy geography moment. Meet my trusty pelvis. This pelvis also has a pelvic floor attached to it. Before I go into talking about the pelvic floor, I want to do a little bit of landmarking on the pelvis. I really encourage you to start thinking about your pelvis as this flexible, articulated area in your body that's able to move and adapt to your baby that will eventually be moving through your pelvis to be birthed into the world. I think a lot of times when we think about bones in our body, we think of stiff, brittle skeletons, kind of like the ones you might have seen in your bio or chemistry class in high school. But living bone inside of your body is much more flexible and elastic. So let's replace that brittle memory with something a little more fluid. In your pregnancy, due to a hormone called relaxin, the ligaments in between the articulations, which are the spaces that hold the bones together of your pelvis, those ligaments are becoming softer and softer, which is why you might find that you have a wobble in your gait, or you might have back pain, especially in your low back, that's coming and going. And a lot of that has to do with the general instability that happens in the pelvis as a result of relaxin, especially in an area called the pubic symphysis, which is right here. The cartilage in between your two pubic bones becomes wider and more unstable as you move through your pregnancy. By the end, sometimes you might be experiencing some pain and discomfort directly in this area as your baby gets lower and the ability for this area to give you support reduces. You have the ilium bones up here, and then you have the sacrum, peekaboo, back here. And down here, you have the ischial spines in the mid-pelvis that flex out of the way when your baby starts to descend and you're getting ready to push your baby out. A few moments ago, I mentioned the pelvic floor, which runs from the front to the back of the pelvis. The pelvic floor is made up of a sling of muscles that help support all of the abdominal organs in your abdominal cavity, including your uterus and your baby. Think of the pelvic floor like a trampoline. It's able to take a lot of force as you push down to release your baby, and as your body and your uterus, even without your help, continues to make that process happen. This anatomy geography is helpful because I want you to understand that when it comes to pushing and getting into positions that are going to help you push effectively, we're really looking to get into positions that are going to help your pelvis and your pelvic floor expand outwards to make space for the baby, as opposed to collapsing inwards, closing the pelvic inlet and making it harder for your baby to get out. So let's dive into how you can do that. What you might not realize about pushing in labor is that there are ways to make it easier. And ideally, you don't want to push for a super long time because it's really exhausting. So how can we make it easier for you and make your pushing more effective? Well, the first thing is when your care provider considers you to be complete, meaning your cervix, the opening of the uterus, has dilated to 10 centimeters and effaced to 100%. Dilation means opening, effacement is shortening and thinning. Your baby will begin to descend into the birth canal or vagina. When that starts happening, you don't need to push immediately. What you want to do is to wait for your baby to descend in pelvic station and to get to at least plus 2. Your body, believe it or not, is actually able to do that without any effort. Your uterus continues to contract even if you aren't consciously supporting it because it knows that its job is to help your baby leave your body. So, if you're having an unmedicated birth, your OBGYN or midwife might say to you, "You let us know when you're ready to push," or "Baby will let us know when you're ready to push." And what they're referring to is that when your baby is low enough in your pelvis, you will feel an involuntary desire to start pushing. And that involuntary desire is typically connected with a lot of rectal pressure, meaning the desire to poop actually means it's probably time for you to start pushing out your baby. If you're having a medicated birth and you're using an epidural, laboring down will already be built in to your birth process. Your care providers will probably say that we're going to let you labor down until the baby gets a little closer, and then you can start pushing, which is actually great advice, especially if you've had a long labor. To close the loop, to make pushing easier and more effective, allow your baby to labor down as low as possible before you start pushing. Let's talk about actual pushing tips and positions. When it comes to pushing your baby out, you've probably heard that when it's go time, you need to push like you're taking a big poop. That's actually not correct, because when you're pushing like you're trying to take a big poop, you're actually activating a different region of your pelvic floor muscles that are more in the back of your pelvis. A better cue would be for you to push like you're pushing out a tampon from your vagina or a menstrual cup, if that's something you've used, or your finger, because those muscles in the pelvic floor are more anterior, closer to the site of action. So that's one thing to keep in mind. Push like you're pushing a tampon or a cup or a finger out of your vagina. And that's actually something, if you feel comfortable, that you could even try practicing now by placing a finger inside of your vagina and trying to just gently push it out. So let's also talk about breathing and pushing. There's so many different types of ways that you can breathe, and whoever is going to be in the room with you can help guide you to what is going to feel most comfortable at the time. And you ultimately are going to find which one is most comfortable for you. But the type of breathing I suggest is diaphragmatic breathing. And one way to practice that, even during your pregnancy, is to practice blowing up a balloon. And also, blowing up a balloon could be a proprioceptive sensory tool, which you can learn more about in the sensory integration and pregnancy module in this class. But for now, we're just going to focus on how it can help you to push. You'll notice when I'm blowing up the balloon that this area of my body, specifically my diaphragm, which is located here, is really getting activated as I'm blowing up this balloon. So blowing up a balloon can be a great tool at this stage of pregnancy to help you get ready to push. Another tip that can help you with pushing is a tip I learned from a nurse many years ago, and that's making the sound hut, like football players do when they're about to kick off a ball. That hut sound actually activates the muscles we really need for you to engage to push your baby out. So you can use the hut right before you start pushing. So the way that that might work in your labor is to take a deep breath in, followed by hut, and holding that hut as you bear down and help to push your baby out of your vagina. Two other things that could help you with pushing, both of which are lesser known, are a mouth guard and a peanut ball. A mouth guard is something that you can use to help you feel more stable and to stop you from clenching and tightening your jaw when you're pushing. One of the reasons why you don't want to tighten your jaw is because your jaw and your pelvis are connected. They're connected through connective tissue, also known as fascia, that extends from the face all the way down to the pelvis. So when the jaw is loose and relaxed, it's easier for you to engage those pelvic floor muscles to be able to help push out your baby. So when it's time to start pushing, go ahead and slide in your mouth guard. What I also like about mouth guards is that they can provide really great oral input and feedback, which can also make you feel more anchored in your body. It's a great sensory tool and a great pushing tool. I mentioned a few moments ago that we want to get in positions for pushing that are going to help your pelvis open up and make space to accommodate your baby. Side-lying positions tend to do that. And right now I have a peanut ball in between my legs, which can be really helpful when it's time to labor down. Laboring down in this position allows your pelvis to stay nice and open and make space for your baby to come through. Peanut balls are great in the hospital if you're having an epidural, because when you have an epidural, your movement is completely restricted and you have to stay in bed. It can be hard to engage gravity, and it can also be difficult to find a position that will feel comfortable, even though you're numb, to leave your legs open and get that space that we need for your baby to come through. So bringing a peanut ball to your hospital can really help. And actually, some hospitals have them available for you to use. If you're having an unmedicated birth, the same rules apply. Pushing on your side maximizes the amount of room in your pelvis for your baby to come through. You don't only have to push on your side, there are other positions you can push in as well, such as getting on all fours and lying over the peanut ball like this. Does about the same thing. Again, make sure your ankles are turning out from each other as opposed to collapsing in order to maximize that pelvic inlet and pelvic outlet for the baby to come through. Other positions you can push in are on your back, standing, and using a squatting bar or a squatting stool, depending on what birthing environment you are going to be in. My hope is that these tips will help you maximize your pushing experience and give you confidence to push from an empowered place.